Socialist Party People Before Profit. You have 4 minutes rather.
Thank you. Good morning, Dr. Nabarro. I want to ask you about the issue of face masks and coverings. You mentioned earlier that you are more and more worried about people who provide services.
Yes.
This morning in Ireland, the leader of one of the transport workers' unions says that face masks and coverings should be made compulsory for commuters. Do you think that's a reasonable position to hold?
So the way you asked the question, it helps me, because yes, I think that is a reasonable position to hold because of what I've seen about the mortality risk of bus drivers and the concerns around people who work as attendants on stations, especially when they're underground or enclosed. So it's a reasonable position to hold. I'm not going to say anything more than that. I hope that's okay.
You mentioned there that you've seen evidence around the world of the risks to transport workers and mortality. Could you give us a bit of information and data on that?
Yes, I'd refer you to the UK study, particularly looking at those working in buses, suggesting that there does seem to be a surprisingly high mortality among bus drivers. And secondly, I've seen other reports, but I've not got numbers on them, of transport staff, particularly in bus or on station platforms in other countries. I'd need to send you that in writing.
I think you said earlier on that one of the countries that you work with directly or directly responsible for is Canada. Is that correct? Yeah.
Yes, that is part of my area of coverage. Yep.
Yeah. So I understand that in Alberta, that masks are distributed free of charge by the state. I understand that that's the practice in a number of other places, Belgium, Turkey, the state of Utah, in the US. Has that had a positive impact in Alberta, Canada? Could you comment on that?
Certainly, the experience I've seen is that people are more likely to wear masks if they are made available to them free of charge. Where I'm living, which is just across the border from Switzerland in France, there is not only a distribution by the local mayor, but also quite a lot of clear advice on when and how they should be worn, and I'm seeing a gradual pickup in wearing. It's not something that can be done immediately. People don't, especially if it's not compulsory, they don't immediately shift to doing it, but it's a kind of gradual process as people get used to doing it. And not everybody enjoys wearing a mask. They feel it interferes with communication. They may feel claustrophobic. We need to be tolerant of the reality that this is quite a new practice. But I'm seeing it pick up, especially where I have seen masks distributed free of charge.
Finally, just a quote, I'm not sure if I can pronounce the man's surname, George Gao, the head of the China Center for Disease Control.
China, yeah.
He told the journal Science that the big mistake in the US and Europe is that people aren't wearing masks. Would you comment on that statement?
Oh, I'm super careful. Can I just say, I don't find it easy to ever look at what countries have done and ascribe difficulty to one issue. It's often a combination of issues that make it difficult to get on top of COVID. And because there's no single playbook, there's just accumulated experience that's been built up over time. It's now quite good. I think that we have to be careful. I personally have said that I believe that the use of face protection is a part of emerging from lockdowns and other stringent controls to being able to live with the virus.